I'm Dr. Manjiri Somashekhar, the lead pediatric surgeon at Aster Bangalore. Today I would like to share some myths and facts about hernia which we see in children as well. So now as a new parents, if you see a diagnosis of hernia in your child, whether it is a boy or a girl, how seriously you should take it. So in a newborn baby, if you see a hernia, which is just a swelling which is appearing in the inguinal region or what you call as commonly as a groin region in your child, which appears spontaneously and disappears spontaneously, it is a hernia which is called as reducible hernia. It is nothing but it is extension or protrusion of the tummy content or abdominal contents like intestines, which are mobile organs, which come into this inguinal region through a common opening called as a inguinal ring or deep inguinal ring, and which appears as a swelling externally. So the newborn children who are prematurely born, they have this symptom quite often, like 80% of them can have it. In case a child is very premature, less than 36 weeks, this has a capacity to heal on itself with the growth of the child. By the end of 3 months, it can disappear by itself. But before that, you have to be very careful. There will be a day where the swelling which was appearing and disappearing on itself, it has suddenly stopped disappearing and it is growing day by day with every cry of the child, and it may end up into an irreducible hernia wherein we can say that the intestine has got stuck into the inguinal ring and it's not able to go inside. This is the emergency situation and you need to get the surgery done immediately unless it will cause perforation or damage to the intestine of this baby. On the other hand, if the child has grown beyond the age of 3 months and now you see that there is a swelling in the inguinal region which is diagnosed as hernia by your pediatrician, you can take your own time at your convenience. You can contact a pediatric surgeon, and before it reaches a point of non-reducibility or disappearance by itself, you need to undergo surgery some or the other day with a fixed appointment with the pediatric surgeon. On the other hand, as commonly this symptom is seen in boys, you also see it in the girls as well. In fact, in girls, there are chances where the ovary keeps popping up in this hernial content. So that is another emergency situation where it doesn't go inside by itself. Then this ovary can get devascularized or it can get stuck into the deep ring, which can be emergency situation again. So though the girls are affected less than the boys, but still the inguinal hernias is seen in both girls and boys, and you need to take it seriously because beyond certain point it is not going to resolve by itself. Another terminology for this hernia, what we call is hydrocele. That is nothing but collection of water into the sac, which is called as a hernial sac. So this is quite common, and instead of intestine, the space is enough for the abdominal water to come out and settle down into the sac. This many times it resolves by itself, and we do wait till the age of 2 years or so. Many babies who show hydrocele at birth, within no time, by 6 months, you don't see anything because the water gets absorbed and the internal ring also gets obliterated, and there is no question of doing surgery anytime later also. So these are the subtle points which one needs to know when your baby is diagnosed with hernia or hydrocele, when to approach the doctor and when to get it operated. Thank you so much.